This morning, we begin our series of reports helping you treat those unexpected accidents that your kids tend to have when they are out playing this summer. We begin with nosebleeds. ER doctor Daniel Thyman from Wolfson Children's Hospital says that the best way to treat the bleeding is to press on the soft part of the nose, right? So if their right side is breathing, you want to push there. If the left, then you push here. Seems simple, right? But a lot of people do the wrong thing. That's because you need to make sure that you apply that pressure for 5 minutes without lifting your fingers, or else it'll just start bleeding again. A lot of people make this mistake because they don't wait long enough. If 5 minutes does not work, then you want to hold it longer for 10 minutes. You do not want to have your child lean forward or backward. If they lean back, the blood can drip into their throat and down into their stomach, which could then make them sick to their stomach and cause them to throw up, which we all know would just make it worse. Dr. Thyman says you do not need to apply pressure with your tongue to the top of the palate or the roof of your mouth, which a lot of people tend to do. And you do not need to put ice on the nose that's bleeding to stop it. And do not try to blow your nose. It then disrupts the clotting and just keeps the nose bleeding if you do that. Next, what if your child's tooth gets knocked out? The best way to save the tooth is to prevent it from drying out. So if your child is old enough, you want to put the tooth back in the socket and have him or her hold it there until you get to the dentist. But if it's bleeding too much or just hurts too much to do that, we get it. So the second best option is to put the tooth, believe it or not, into a cup of milk. Make sure it's submerged. Milk contains several things that the cells on the root need to survive, like sugars, antibacterial agents, proteins, that maintain the right balance of acids. It does not matter what kind of milk, by the way. Skim, whole, low fat, doesn't matter. But it is better to use milk than to use water when you're trying to keep it from drying out, since immersing the tooth in water can actually cause the cells on the root to swell and burst, which means it cannot be reimplanted. So if you don't have any milk and your child is old enough, you can have him or her hold the tooth on the inside of their cheek to keep it moist as long as they're old enough and they don't swallow it, right? So if they're too young, you can put the tooth in a cup and have your child actually spit in it enough where it covers the tooth and get to the dentist as soon as possible.